Welcome to the Children's Health and Education Mapping Tool. I'm going to provide a brief tutorial about two layers of the tool, the Children's Health and Education Indicators layer and the SBHCs and School Characteristics layer. I'm going to talk through two hypothetical situations in which you could use the mapping tool to support a strategy for improving child health and education outcomes. In the first example, I'm going to describe the hypothetical situation that the State Department of Health in North Carolina has allocated $10 million to expand school-based healthcare. A group of SBHC advocates, providers, administrators, state-level advocates are working together to come up with a strategy to expand access to school-based health centers. They want to expand access in areas that need them most. So the first thing I will do is go to the Children's Health and Education Indicators layer. And I'm going to select North Carolina. Next, I want to identify the counties underperforming compared to the national average on powerful predictors of need. We have 12 indicators of need included in the mapping tool, and they're grouped in 4 categories: health insurance and coverage indicators, health indicators, education indicators, and demographic and socioeconomic status indicators. I'm going to go ahead and open the Health Insurance and Coverage Indicators tab. First, I'm going to select the percent of children under 18 on Medicaid and CHIP. What you'll notice is that counties underperforming compared to the national average are highlighted in blue. The tool is automatically set to the national average. And if you're interested in knowing what the national average is for each of the indicators, click on the info buttons, and you can see that the national percentage is 39%. You can also view the source of data. Next, I want to add the locations where there's high levels of uninsurance among children. When I add this indicator to the tool, you'll begin to see that certain counties are in darker shades of blue. Those counties are underperforming on both indicators. My objective is to identify the counties underperforming on multiple indicators of need. So I'm going to go ahead and add in the other indicators in the tool. Under health indicators, I'm going to add in teen birth rate, adult population percent obese, total population percent food insecure, and chlamydia rate. Point your attention to the counties that are in the darkest shades of blue. Those are the counties that are underperforming on multiple indicators of need. Next, I'm going to add in education indicators and demographic and socioeconomic status indicators, including the percent of children on free lunch, percent of kids in poverty, percent of kids in single-parent households, the percent of households with severe housing problems, and violent crime rates. Now you can see a picture starting to emerge that shows the counties that are underperforming on multiple indicators of need. Use the coincident indicator summary to identify counties underperforming on multiple indicators. Here I'm clicking on the counties underperforming on 10 indicators, and I can identify 21 counties in the state of North Carolina underperforming compared to the national average. Click on any county to view characteristics about that specific county, including the total population ages 5 to 17, the number of public schools, the number of SBHCs in the county, the number of SBHCs in the state, ethnicity data, and the values for each of the indicators included in the tool. If you want to see the values for the entire state of North Carolina, click over here on Data and Analysis. It'll open up a table which you can download to Excel, which shows the values for each of the data points included in the tool for the specific state that you're working with. Next, I'm interested in knowing, are there school-based health centers in these counties with high levels of need? I'll go to the SBHC and School Characteristics tab and click on School-Based Health Centers. What I can see is that green and brown dots emerge. The green dots represent school-based health centers who completed the 2016-17 National School-Based Healthcare Census. The brown dots represent school-based health centers that did not complete the 2016-17 census, but we know that they are operating. Click on any school-based health center to view characteristics about that SBHC, including its address, the number of schools with access to the school-based health center and the number of students eligible to use it, the grade levels served, the percent of students eligible for free in-school lunch, and more information. I'm interested in focusing on the counties in the state that have high levels of need but no school-based health centers. I'm going to zoom in the lower part of the state, the lower southern part of the state, to look at these counties where there's high levels of need but no school-based health centers. My next question is, are there schools that could provide homes for the school-based health centers? If I click on public schools, the locations of all public schools across the country are added to the tool. I can filter the schools based on various criteria. For example, Title I eligibility, the lowest or highest grade level served, and free and reduced lunch eligibility. So what I can see is that there are plenty of schools in these counties that could serve as homes for school-based health centers. Next, I want to know, are there health facilities that could serve as sponsoring organizations for these school-based health centers? Under optional layers, I'm going to click on healthcare facilities and add the locations of hospitals, health center programs, or FQHCs, rural health clinics, and substance abuse treatment centers. Here you can see the picture emerging further. There are hospitals, FQHCs, rural health clinics, and substance abuse treatment centers that could be medical sponsoring organizations for these school-based health centers. If you look to the bottom of the screen, you can see a legend which will show you the indicators that are included in the tool. This information, paired with local level relationships, partnerships, and understanding of the geographic area, could help this group of stakeholders in North Carolina plan for the expansion of SBHCs. In the next use case, I want to talk about how you can use the Children's Health and Education Mapping tool as part of a strategy to address teen pregnancy. I'm going to provide a hypothetical example of a group of stakeholders in the state of Arkansas who are interested in expanding school-based healthcare beyond their already thriving school-based healthcare landscape to try and address teen pregnancy. We've selected the state of Arkansas because it has the highest rates of teen pregnancy in the country. So the first thing I'll do is go to the Children's Health and Education Indicators layer. I'll select the state of Arkansas, and I'm going to add 3 indicators to the tool. First, I'll add teen birth rate, and what I see is the counties underperforming compared to the national average are highlighted in blue. If I click on the info buttons, I can see the national average and the source of the data. Next, under education indicators, I'm going to add the percent of the adults with no high school diploma. Again, the counties in darker shades of blue are counties that are underperforming on both indicators. Finally, I'm going to add the percent of kids in poverty to the tool. And I'm going to look at the counties that are underperforming on all 3 indicators. What I can see is that there are 64 counties in the state of Arkansas underperforming compared to the national average on these 3 indicators. My next question is, are there school-based health centers in these counties? I'm going to go to the SBHC and school characteristics layer and add in the locations of school-based health centers. The answer to the question is that yes, there are school-based health centers in some of these counties, but there's tremendous opportunity for expansion. I'm going to click on any of these counties to see characteristics of these counties, and I want to be focusing in the southeast corner of the state, where there are high levels of need and no school-based health centers. Next, I want to know, are there schools that could serve as homes for these school-based health centers? I click on public schools and see that there are plenty of public schools in the area that could serve as homes for these school-based health centers. Under optional layers, I click on healthcare facilities and want to see the locations of hospitals and health center programs, or FQHCs, and see that there are numerous hospitals and FQHCs that could serve as partners in opening school-based health centers to address these challenges. I'm going to focus specifically here in the area of Pine Bluff, where I can see, if I zoom in further, there are a number of schools, as well as a hospital and 2 federally qualified health centers that could potentially be partners in working in this local area to address the challenge of teenage pregnancy using school-based health centers as part of the strategy. This information from the mapping tool, paired with local level partnerships and relationships, can be part of a strategy to address this healthcare challenge. If you have questions about the Children's Health and Education Mapping Tool, please reach out to us at www.sbhforall.org. Send us an email at research@sbh4all.org. Thank you.